Hi, my name is Andre George, and today we're going to talk about chronic fatigue syndrome. What is chronic fatigue syndrome? It is a debilitating illness associated with serious changes in physical, mental, and occupational well being. The most notable of which is fatigue. It is a disease characterized by sleep abnormalities, pain, and other symptoms that are made worse by exertion. At least 1 million persons in the United States suffer from CFS. There are more than 200,000 cases per year, and it affects all racial and ethnic backgrounds. Studies do show that it's more prevalent in women, and it is also more common in people from ages 40 to 50, but it also affects young kids too. What causes CFS? Actually, there's no confirmed cause. Like, there's no exact cause for chronic fatigue syndrome, but there are many theories behind it. It could be due to environmental factors or genetic factors. Some experts say a viral infection such as glandular fever can trigger the condition. Certain bacteria have been suggested as some cause of CFS in some people. It could be problems with the immune system or hormone imbalances, or it could just be like a bunch of different factors all together just to cause it. But people are still doing research, and there's no one cause for chronic fatigue syndrome. They're still doing research about it. Symptoms of CFS: people may face pain in their joints, muscle, inability to exercise, or malaise. People experience confusion, forgetfulness, or a lack of concentration. They may have strong feelings of anxiety or apprehension. They will undergo depression, headaches, muscle weakness, sore throat, and excessive sleepiness. There are a lot more like symptoms of it. As you can see here, you can get sinus, nasal problems, swollen glands, tender lymph nodes, sore throat, abdominal issues, stomach pain, bloating, nausea, light sensitivity, and chills. You can also get unrefreshing sleep and other sleep problems, and post exertional malaise or PEM. In other countries, chronic fatigue syndrome is also called myalgic encephalomyelitis. It's a big word. That's what the ME here stands for, in case you needed to know. Diagnosis. The main diagnosis is if you feel fatigue for over 6 months. Fatigue worsens with activity, but it doesn't improve with rest. So the amount of sleep you had one night would not like make it feel better the next day. It doesn't improve it. Doctors have to rule out many other illnesses before they confirm that you have chronic fatigue syndrome. Illnesses such as sleep disorders, medical problems, and mental problems. Treatments. Well, first of all, there's no known cure for chronic fatigue. That's unfortunate. But there are many therapies you can do to like lessen it. Self-care, stress management, pursuing an enjoyable activity, or verbalizing frustration to reduce stress and improve mental health. So just find something that you like to do: bowling, swimming, cleaning, just jogging. Just incorporate that more into your life, and talk out more. Like, let people know like what's going on. Express yourself. Other techniques are relaxation techniques, deep breathing, meditation, yoga, rhythmic exercises, and other activities that reduce symptoms of stress. Other therapies are support groups. Support groups are always good. Like, you just find a group of people who have the same problems you have, someone you can relate to, like tell them your problems. And this is good, like when you're all in the same boat, you can like all have goals, set goals, like main goals for like losing weight, you know, just like small goals that you can that you can do. Cognitive behavioral therapy, a talk therapy that focuses on changing or modifying your negative emotions, thoughts, actions, and just like turning it into positive thoughts, emotions, and actions. And another therapy is graded exercise therapy, which is basically you do something, you start slow, low intensity, you work your way up past moderate to high intensity. Um, could be something like biking on a treadmill or swimming. You start slow, then you work your way up. Another way you can do it, like for every day, is like when you're cleaning, you start small, and then you work your way up to the harder task. Great exercise therapy. Other treatments include medication, antidepressants, prevalent or relieves depression and elevates mood. You can see a specialist, primary care provider, someone to prevent, diagnose, and treat the disease. Just have someone to overwatch you, make sure that everything's going okay. You can also see a clinical psychologist. They treat mental disorders, primarily talk therapy also. So my case study, the case study. Joanna Fox is a 45-year-old insulin-dependent diabetic for the past 4 years. Her health is well controlled through diet, exogenous insulin, and occasional walks. She is 5'2", 105 pounds, and very nervous. Her total cholesterol is 220 milligrams per deciliter. Her HDL is 38. Her triglycerides is 170. And fasting blood glucose is 120. She has been a secretary for about 20 years. She really likes visiting her nieces, but she does not have the energy to keep up with them. Her resting heart rate is 71 beats per minute, and blood pressure is 110/88 milligrams per mercury. Her father died at the age of 60 from a myocardial infarction. Her mother is an active insulin-dependent diabetic at the age of 81. She has been feeling extremely tired lately, with little aches in her joints and muscles. She has just been diagnosed chronic fatigue syndrome, and her doctor recommended that she starts participating in regular exercises and physical activity. Risk stratification. First of all, the client is 45-year-old. She's a female, so her age and her gender puts her at no risk right here. Her current risk factors. She's not a risk, like based off her family history. Her dad died at the age of 60 due to a heart attack, but that doesn't affect her. If he had died at the age of 45, then it would be considered a risk factor. Uh, the client, she doesn't smoke. Well, it doesn't say that she smokes, so that's unclear, but that doesn't put her at risk. The client is 5'2". She weighs 105. So this puts her BMI at 19.2, which means she is normal weight. She has no risks in this apartment. Good for her. Her blood pressure is 110/88, which is normal in the category of hypertension, that scale. So she has no risk here. Her total cholesterol is 220, and that is above normal. That puts her at risk. Her HDL is below the normal limit, which is 40 milligrams per deciliter. I think hers is 38. That also puts her at some sort of risk, but not too much. Her triglycerides is borderline high at 170. This does put her at risk, and all this information is taken it all up. She has a risk for coronary disease. The client has been a diabetic for the past 4 years, and her fasting blood glucose level is 120. She does have a sedentary lifestyle. She goes on occasional walks, but this does not fit the recommended prescription, which is 3 to 4 minutes, 3 to 4 times a week for 30 minutes each time. Based on all the information that we got at the client, she is at high risk. And compounding the risk for the client is determined the client had due to cholesterol and fasting glucose level, plus the fact that she is a known diabetic, that puts her at high risk. So according to the ACSM guidelines, a medical exam is required before moderate exercise and vigorous exercise. The client goals, simple. She wants to be more active, and have more energy to keep up with her nieces. Exercise testing. It is important to have a physician there to monitor any signs or symptoms. A medical exam is required before moderate or vigorous exercise. When testing, test for cardiovascular fitness, muscular fitness, balance, and flexibility. Recommended tests include the following, which is a 6-minute walk test. That's simple. You can do that to test cardiovascular fitness. Hand grip dynamometer grip test for muscular strength. One leg for balance, and sit and reach test for flexibility. Exercise prescription, fairly simple for her. Aerobic endurance, 30 to 60 minutes, 3 to 5 days a week, with low, moderate intensity. Exercise such as jogging, walking, biking, or swimming are beneficial. Muscular endurance and strength, 2 to 3 days a week at moderate intensity, 50 to 60% of the patient's max. 3 sets, 10 reps each exercise. Make sure they hit all the major muscle groups throughout the week. Key weight exercises are recommended to improve balance. Performing exercises such as bicep curls, squats, lunges, tricep extensions, and crunches, etc. Flexibility, at least 2 days a week for at least 10 minutes. Just make sure you stretch that muscle to the point of discomfort and hold it there for around 15 to 30 minutes, 30 seconds, sorry, not 30 minutes, that'd be a long time. And just make sure you hit all the major muscle groups. In conclusion, we must all understand that exercise is medicine, and it helps a lot for individuals who suffer from chronic fatigue syndrome to stay active, be social, and always seek help when you're feeling distress. Knowing that there's no cure, there are treatments, and I mentioned treatments before. And honestly, I think the best treatment will be like just to be doing physical activity all the time, and just do it as it says, like graded. Start slow, and you work your way up to high intensity. But it is something that can be treated, that can be lowered, so you're not feeling like fatigue 24/7. So just keep it up, keep going, doing exercises with the client. If she does that, she should be fine. She eats right, and she should be at her goal in no time. This is my presentation. Thanks for listening. See you guys later.